next speaker, Dr. Don Nease, who's the Vice Chair for Community and Professor of Family Medicine in the Department of Family Medicine in the University of Colorado School of Medicine. Don is also the Director of the CCTSI Community Engagement and Research Program. And Don is going to speak to us about what's become an extremely important area, and that is health equity, or actually health inequities and COVID. And he's going to speak about the Colorado Community Engagement Alliance Against COVID-19 Disparities, Colorado SEAL, which is a new NIH-funded program. So Don, take it away.
All right, thanks very much, Ron. It's great to be with you all this morning and to talk about this very important topic in terms of how COVID-19 has really impacted some of our communities here in Colorado and actually nationally as well. And I'm especially delighted to have as co-presenters a couple of our community connectors from our Co-SEAL project, Stephanie Salazar-Rodriguez and Lisa Lucero, and you'll be hearing from them later in the presentation. So I want to cover kind of what happened and what is still happening with respect to vulnerable communities related to COVID-19. We'll talk a little bit about our vision as we were putting together our application for the NIH SEAL program, what we're actually in the field doing right now, and hopefully have some time for questions. So let's start by rewinding the clock here to the 1st of March, 2020. And I'm gonna go through a series of cover pages from the Denver Post just to kind of show how this was rolling out. This was March 1st, 2020. You can see just a start of a glimmer of evidence about COVID-19, first US death and outbreak, but it certainly wasn't dominating the front page. We fast forward a week and we've got a little bit more, some stuff about the White House's response, but still not the dominant thing on the front page. And now we begin to see things start to change. And this, I remember this very clearly. This was the week when I think our campus started to close down. You can see spread of virus, idle ski resorts. So for folks who aren't from Colorado, that's a big deal in this state. And you can see also there on the right, restrictions on visiting in nursing homes. So going forward another week, now COVID is starting to take over the front page, a moment when normal change, and really focusing on how this is starting to impact folks in the hospitality industry, restaurant workers, et cetera, something about the federal rescue program, and deaths here in Colorado and cases here in Colorado. As we move forward then to the following Friday, again, it's completely taken over the front page. Colorado deaths hit 27, finances of rural hospitals in danger, violators of stay-at-home order can face warnings, fines, even jail time, and US now leads the world in number of COVID cases. And as we go just a few days after that to the Sunday paper, some discussion about not Colorado's first pandemic and layoffs slamming state's hotel workers. So that's what was going on here in Colorado. I pulled a couple of papers just to give us some perspective on what was going on nationally. This is the first one of those. And if y'all want access to the paper, you can go ahead and scan that QR code. This paper used publicly available data to look at age-specific mortality. And this was looking backwards from July 22nd. So this is still fairly early. It didn't seem that way at the time, but as we know now, still fairly early. And they looked at age standardized mortality rate ratios using non-Hispanic whites as a comparison group across all other races and ethnicities. Also, this really interesting statistic of years of potential life lost before age 65. And as you'll see in the graphs on the next slide, pretty significant differences when you look at non-Hispanic Blacks and Hispanics compared to the reference category. So here are those graphs, and I think this is really cool the way they displayed this data. You can see along the bottom there, the age categories, and across all groups, as we move up in age, you can see the increases there. And you can see, again, these are all compared to a reference category of non-Hispanic whites. So non-Hispanic Blacks, dramatic increases, Hispanic or Latino, dramatic increases, not quite as much in the American Indian Alaskan Natives, and not quite as much in the non-Hispanic Asian or Pacific Islanders, but still present. So this next paper takes this one step further by actually then bringing in socioeconomic status. As we all know, social determinants of health are huge, and no difference here in COVID-19. And so this was a really interesting paper that they did this by comparing mortality rates from the first quarter of 2018 and the second quarter of 2020. Again, looking at subgroups defined by individual socioeconomic characteristics. And they found that Black people experienced the highest increases in mortality across all socioeconomic categories, and also significantly higher increases for Hispanic adults as well. So here's the first of those figures. On the left here, just looking at uninsured versus insured, no surprise there. Family income level, that first bar there is for folks below that 100% poverty level. You can see increases there. And then on the right, employment characteristics. So if work from home is possible, you're protected. If you were an essential worker, again, fared worse. Now let's look at this when you add in the race and ethnicities. And as you can see, non-Hispanic Blacks, dramatic increases in these rates, and also for Hispanics as well. So pretty interesting data. Just to focus in here on Colorado, just looking at the case rates, and this is data that I pulled last week from the CDPHE website. Hispanics, you can see higher in terms of proportionality compared to their demographic representation in the state as a whole. Other categories, not significant increases there, perhaps a little bit for the American Indian or Alaskan Native. So you begin to get an idea of the groups that were most heavily impacted. When we look at vaccination rates here in Colorado, again, data that I pulled just here in the last few days, you can see Hispanic or Latino ethnicity not hitting where they should be in terms of demographic characteristics. Also American Indian, Alaskan Native are really close there. Black or African Americans a little better, but still not quite where they should be in terms of their proportion of the population. And in fact, even white non-Hispanic, not where we should be. This is just looking at counties in Colorado. I think just to give us an idea of where vaccination rates are actually fairly high and where they're fairly low. And for those of you that know Colorado demographically, some of these areas like San Luis Valley, rates are low there. Rural Eastern Colorado, especially low there, and also rural Western Colorado. So with that, I'm going to bring onto the stage our Co-SEAL Community Connectors, Stephanie Salazar-Rodriguez and Lisa Lucero, to tell you about what they've seen in their own communities. And we'll start off with Stephanie.
Good morning. Thank you so much for having me. My name is Stephanie Salazar-Rodriguez, and I am the Co-SEAL Community Connector for urban Latinos in the Denver metro area. Additionally, I'm the founder and lead trainer of Blazing Cloud Consulting, which is my small business. I come from a mixed Latino and Native American familiar background. I have extensive training in public health, and I'm a seasoned promotora de salud, and I've been working in the community for over 25 years. Soon after the pandemic started, it became abundantly clear that my communities were being disproportionately impacted by COVID. The severe illness and fatality rates were not going to subside if we didn't have some type of community intervention. Consequently, taking resources directly to the community if we want to combat this public health crisis is essential. On a weekly basis today, I still receive phone calls, text messages, or emails from community partners, family, and friends, all asking for resources related to COVID in some way. Thankfully, because of my vast array of connectors and promotoras, I can provide resources. Because of my work in community, I was contacted by the staff from Denver Public Health and asked if I could set up testing sites. Actually helping them, I didn't actually set them up, I helped them. Of course, I immediately said yes. As you can see from the slide there, I have collaborated with several community partners to initiate COVID testing sites, and I hosted 5 educational workshops. This was followed by scheduling of community members for the vaccination clinics that were sponsored by the local Latina legislators who went to the governor and said, we need to do something. We need to take these to the community. So through these collective events, we served nearly 3,000 people, primarily from the Latino community. Countless people that I scheduled for the vaccine just were so profoundly grateful. One woman called me her guardian angel, and she stated, you're truly saving lives. A lot of these people shared my phone number with their friends and family, and I received countless inquiries as late as 10:30 at night, early as 7 in the morning. People just wanted to have the vaccination. These events were followed by participating in the monoclonal antibody treatment community stakeholder panel. Then I was able to help distribute 100 COVID home tests, and now I am so proud to be part of the Colorado SEAL team. Throughout my work in the COVID pandemic, I've encountered many individuals who have been personally impacted. Early in the pandemic, one of my community partners called me frantically, asking for assistance in getting her daughter tested for COVID. This was before all of the COVID testings were available. She explained that her daughter, who was in her early 20s, was working delivering beverages to local grocery stores, and she had 2 coworkers who were also in the early 20s and had tested positive for COVID. She had no idea where to turn. Sadly, one of the coworkers succumbed to COVID complications. Her daughter was extremely distraught by the death of her good friend. And initially she tested negative, so she quarantined for 2 weeks to make sure she was safe. But she continued working as this, being somebody who needed to be out in community. And she also eventually tested positive for COVID. Initially, she didn't want to get the vaccination. She was very dead set against it, but she did get it 90 days after her symptoms subsided. However, today she's still having lingering symptoms months later. And, lots of people are calling them long haulers. Once her daughter contracted COVID, several other family members also tested positive for COVID. The family was extremely impacted, but now they're strong advocates of the vaccination. As a matter of fact, she was so committed to the vaccination that she volunteered to be a guest speaker at one of my workshops where she shared the sad story. COVID has touched so many people in my inner circle. And personally, I have lost 2 uncles, an aunt, a cousin, and a brother-in-law. Additionally, the sister of one of my friends was in the hospital on a ventilator for 164 days, and somehow she survived. She's now in rehabilitation where she's undergoing extensive therapies to try and return to some semblance of normalcy. Lastly, countless other family members, community people that I know of all ages have suffered moderate to severe COVID symptoms, many of them requiring hospitalization, some on home oxygen, and some doing home rehab after being on a vent for many, many days or months. If we really want to successfully access communities in any public health concern, we must engage the trusted leaders. There are many historical barriers when it comes to communities trusting, understanding, and accepting science, especially after hundreds of years of mistrust from various government entities. Personally, I believe it is my duty and responsibility to be on the front lines to bring awareness, education, and resources to my communities. The ultimate goal is to mitigate risk factors, improve overall health outcomes, and close the health and public health equity gap. I am so excited to be part of the COSIL team, and I really know that our work has just begun. Thank you.
Thanks so much, Stephanie. As you can tell, Stephanie is our Denver metro area community connector. Now we're going to move to Lisa Lucero, who is down in the San Luis Valley. Lisa?
Thank you, Don. I'm Lisa Lucero, the Director of Implementation for the San Luis Valley Area Health Education Center and the COSIL Community Connector for the San Luis Valley region. Today, I'm going to talk a little bit about the faces of COVID in my community. I kind of fell into outreach in May of 2020 when I was providing food to those who were quarantined. I heard that when local healthcare providers were delivering COVID-19 results to Spanish speakers, they would state "son positivo," you are positive. Many Spanish speakers would equate positive to being a good thing. And Luis Villagomez, who's pictured in the top right, was one of these people. He misunderstood his results, and after 3 days, he was still feeling ill and went back to the clinic and asked to be retested. They advised him that there was no need for another test as he was positive. Luis later succumbed to COVID-19. In fact, several of his family members were also positive. He did have some pre-existing conditions, but we'll never know if 3 days would have made a difference. Luis's story isn't finished yet, though. And some good did come out of it. I did reach out to the local healthcare providers and told them of the error they were making when they were transmitting information about COVID-19 results, and they adjusted how the results were given. His story was also a catalyst to the formation of a promotora movement in the San Luis Valley. And for those of you who are unfamiliar with the term promotora, they are community health workers that work and live in Spanish-speaking communities. Well, most of their work was focused on COVID-19. They also provided guidance in accessing community resources. They served as liaisons between the community, health professionals, and social services organizations. They often play the roles of advocate, mentor, and interpreter. Luis's story still isn't finished. His brother, who's pictured in the middle, and his sister-in-law, Maria, who's pictured at the bottom, became promotoras. They have helped thousands of people during COVID and have developed into these amazing community leaders. Currently, the SLVA is trying to form a promotora program that will be sustainable past COVID. As I stated before, I fell into COVID outreach, and at times it was really trying. But the one thing that kept me going was this mantra that our group had: "Si no nosotros, ¿quién? Si no ahora, ¿cuándo?" If not us, who? If not now, when? Thank you.
Thanks so much, Lisa. As you can see, we are really, really fortunate to have folks like Stephanie and Lisa as part of our Community Connector Dream Team in our targeted communities for COSIL, which is our Colorado Community Engagement Alliance against COVID-19 disparities. So I'm going to finish up with just a few words about that work. So back in February, we had the opportunity to apply for this funding from NIH. And it was a very quick turnaround. We had just a few weeks to put this together. But fortunately, we had some existing partnerships and we sought to partner with communities most impacted using approaches that we'd really already proven through work through our CCTSI Community Engagement Core. We also wanted to use this as an opportunity to build capacity for this kind of work in communities. And we wanted to make sure that over half of the dollars from this project really were going into community, building capacity, really utilizing folks like Stephanie and Lisa to help overcome these disparities. So this is from the National SEAL group, just to give you an idea of the communities of focus and also the overall objectives of establishing partnerships, addressing misinformation, growing an understanding and trust in science, and accelerating the uptake of beneficial treatments. And we're right in line with that here in Colorado. You can see where SEAL teams are located across the country. The blue cohort started last fall, and then the tan cohort, which we're a part of, was funded this April-May timeframe. So what we're doing is we're focused on African-American, both urban and rural populations. Our rural focus there is actually African immigrant folks in Morgan and Weld County in Northeast Colorado. Our Hispanic Latino communities, both in urban Denver and Pueblo, and then in the San Luis Valley. And finally, our American Indian Alaska Native folks here in the Denver metro area. As partners in this work at the PI level, I've got Dr. Sokol, who's the leader of CCTSI, and also Dr. Ricardo Gonzalez Fisher, who's a Mexican-trained physician who lives here in the Denver area and works with Servicios de la Raza. So how are we actually doing this? So we're focusing on these 5 communities, again, with some splits around the urban-rural divide. We're doing 2 rounds of what we have traditionally called boot camp translations. We're modifying that based on feedback from community to call them community translations. This is a tried and true method of ours to really take scientific facts, evidence, and use those to create messages and materials that really resonate with community using their words, their language for this. We'll be doing a first round starting actually this week, focused on adult vaccinations and adult COVID. And then in the fall, we'll be focused on childhood vaccines. Community connectors, you've heard from 2 of those. They're also helping us not only with the bootcamp translations, but also recruiting 5 cohorts of 200 folks in each community, where we'll be doing baseline and then subsequent surveys on their knowledge, attitudes, intents, and actual vaccination rates. And then finally, we're working on clinical trial participation in impacted communities through the establishment of a clinical trials advisory board and then clinical partnerships with Denver Health and Salud. That community clinical trials advisory board is being led by Dr. Gonzalez Fisher, and we'll have membership from clinical trial PIs and community members, and will be available to provide consultation to folks that are launching trials. Here are some of our partners. We've got a great group of folks that are helping us with this, really dedicated to this work, and it's really exciting to work with everybody. If we have time for any questions, I'll be happy to take those. You can scan this QR code to get to our website. We have a Twitter handle if you're interested in following us. And thanks for the time to talk with you all this morning.
Thank you, Don, and your team. Just a reminder, if you have any questions, type them in the Q&A tab at the bottom of your screen, not the chat tab. And there is a question here for you, Don. And the question goes, I wonder if the presented data analysis has considered the intersection of socioeconomic status and race, ethnicity. If so, is there synergistic or is it an accumulative impact of this intersection?
Yeah, great question. Thanks, Mo, for that. That second paper that I referenced, and again, the slides will be available. I would encourage you to take a look at that. They did look at socioeconomic factors like employment, percent of the federal poverty level, and we did see definitely synergistic or cumulative impacts based on those, in addition to what folks were already experiencing just based on their racial and ethnic category.
And Don, is your group going to be tracking vaccine rates in Colorado among your populations that you're studying? And if so, is there a way to attribute your efforts, your group's efforts, to any changes in the vaccine rates?
Yeah, thanks, Ron. So we are going to be tracking that in our cohorts that we'll be surveying. Additionally, we wanted to make sure that we were getting adequate reach into these communities. So we'll be using social network analysis methods, assisted by Jenny Cross, who's part of our Colorado State CCTSI team, to help us with that work, along with Matt DeCamp, another member of our great team that will help us understand how deeply are we reaching into communities for that.
Okay, one final question. Are there any other ways that we can reach local underserved communities? How do we find the community leaders for a diverse group of people?
So I'm going to toss that question to Stephanie and Lisa. Do you guys have any thoughts about that?
That was my first thought. Let me touch this one. First and foremost, it depends what community you are going into. If you are going into the Latino community, some of the people that Don listed, including myself, as I have been involved for over, like I said earlier, over 25 years, we are people that can really help you when we're talking about getting to the trusted leaders. There are so many different ways, but the biggest way is continuing to have these community events that we're hosting in regards to the vaccination, testing, all of the pieces of it. And now with the boot camp, we actually will be starting tomorrow for the metro area, the Denver metro cohort. And so that is starting tomorrow. So what we have done is people like Charlene Barrientos and Montel Tamez, who are with the university, they also have significant contacts in the Latino community here in Denver, and they have done an amazing job reaching out to the leaders. And each of us who has our own network, we're able then to also connect additional people to our groups of people. I serve on many, many different community advisory panels, and there are tons of leaders in the Latino community that we can tap into. So if you have any questions or concerns, I would be happy to talk to you as well. I can put my, can I put my email in the chat, Don? Will people be able to see it, or only the?
Yes, yes, absolutely.
Okay.
All right.
Lisa,
any comments?
No, she kind of hit the nail on the head. And just by having these different meetings and talks or vaccine equity clinics, you kind of get to meet new community leaders within the community that you never even knew existed. They kind of come out of the woodwork. So